Hi everyone, in this video I'm going to show you how to update healthcare worker details in the Excel sheet and how to save the Excel sheet and how to mail the Excel sheet. So this is the Excel sheet which has been mailed to you all. So this Excel sheet has around 24 fields which is mandatory fields to be filled, and that means no cell should be left blank. So I repeat, no cells should be left blank. So I will go one by one. In the column A, we have a state. So you can see here in this cell we have a drop down. So that means there is no need of typing anything, just to select the state from the drop down list. So I have selected Karnataka. So if you type anything in this drop down cell, that means it will affect the Excel sheet and it doesn't get uploaded to the online portal. So please don't write anything or don't type anything which has a drop down option. So just select it from the drop down option. So I've selected here Karnataka. So next comes district. So I've selected Bangalore urban. Then comes block. So in Bangalore urban we have 4 taluks. So make sure to which location or which taluk your facility belongs to and mention the block name. So here I have written as Bengaluru North. So your taluk name should be like this: Bengaluru North or Bengaluru South or Bengaluru East or Anekal. So this is a way of typing or mention the block name. So please make sure to which block your facility belongs to, then you can mention the block name. So I've given here as Bengaluru North. Then comes category of facility institution. So in this cell we have a drop down. So we have to select from the drop down option. So two option has been given here, government and private facility. So I've selected private facility. Then comes name of the facility. There is no drop down. That means we have to type the name of the facility. Here I've kindly look into this cell. I've typed the full name of the institution. So this is the way of typing the name of the institution. Kindly don't mention in a short form. For example, for Kempegowda Institute of Medical Science, kindly don't mention KIMS. So it has to be in full form. So Kempegowda Institute of Medical Science. So this is a way of writing the institution name. Then comes location of the facility. Here there is a drop down option, so kindly click on the drop down option and we have two options here, rural or urban. So to which locality or facility belongs to, kindly click on that option. Here example I have selected urban. In the column G we have address of the facility. So kindly look into this cell. So I've mentioned the complete address of the facility: KIMS Hospital, Krishna Rajendra Road, Vishweshwarapura, Bengaluru, Karnataka. So in this cell I have not used any comma or a full stop. Just I've used space. So this is a way of writing the address of the institution. So when the next comes the institution postal code. So I've mentioned the postal code of the KIMS Hospital here. I have not used any alphabetical format. So I've given in a numerical format. So you can also observe here there is a star mark in the heading. That means these fields are compulsory to be filled. So after mentioning the postal code of the institution, the next column comes type of the institution. So from the drop down list we have options whether your institution belongs to corporate hospitals, whether institution is medical college or a nursing homes or a OPD clinics or a polyclinics and others. So if for example KIMS belongs to a medical college, so if your facility doesn't fall under these categories, you have an option of selecting others and specify to which category your institution belongs to. So I repeat, if your facility doesn't falls under these categories, you have an option to select other and fill your facility name or facility category name. If your institution falls under these columns, for example, medical college, then this column you have to type as NA, not applicable. So in the beginning only I said that none of the cells to be left blank. Hence, if that cell doesn't apply to your, so you have to mention it as NA. The next column is category of health worker. So from here, from state to from state to column I, for all health worker it will be same. From here it keeps on changing based on the workers designation and workers working environment. So the category of health workers goes like this. If a health worker belongs to a field level health worker or a medical officer, or if they belong to nurses or a supervisors, so based on their working condition you have to select the category. For example, I'm going to select a medical officer. Then here, as I selected medical officer in this column, so this column will become NA, that is not applicable. If the category of healthcare worker doesn't fall under these indicators, then there is an option for others. Then mention the category of a health worker. If you select anything from the drop down list, for example medical officer, then this will become NA. Then comes beneficiary name. So I will just give an example of XYZ beneficiary who is a medical officer. Here I need to mention one thing, that there should be no any suffix to be mentioned. For example, like doctor or Mr. or Mrs. So Miss, so that not should not be mentioned in the Excel sheet. So a name should be without suffix and prefixes. So here I'm just going to mention XYZ, or I will just give an example. Banu Prakash. So he's a medical officer. So I've just type Banu Prakash. Banu space Prakash. If there is an initial, you can give it as space then initial. So there is no full stop, anything such things like that. So you should also not mention any full stop in the cell. So coming to the next column, column N, photo ID type. So there is a drop down here. So just click on the drop down. So you have a different option to select for photo ID. You can also see here in the heading there is an except Aadhaar. That means Aadhaar is not mentioned in the drop down list. Hence, apart from Aadhaar, you can select any category for photo ID type. If you have a driving license or a PAN card or a passport or a passbook, so you can select any one of the option as photo ID type. If a health worker selects a passbook as a photo ID type, then in ID number it should be customer ID number only. So you should mention only customer ID number, not the account number. So when a health worker selects passbook as his photo ID type, you have to mention customer ID number, not the account number. And there are other options like PAN card or a passport or a voter ID, anything like that. So here I've just I will select PAN card. Then so I'll just mention some, give some few examples like this. So this is a photo ID type and ID number. So then comes gender. There is a drop down. So based on, so I select the gender. Then comes date of birth. So as I am saying, wherever whichever cell has a drop down, you have to select from the drop down itself. Kindly don't type anything which has a drop down. So I'll select from the drop down. So month of birth, then year of birth. So this is the way of mentioning your date of birth of the health worker. So then comes the mobile number. So kindly mention 10 digits mobile number, 10 digits number which is active, because you will be receiving a message to this mobile number that your beneficiary has been registered in Government of India portal. So hence kindly provide the mobile number which is in active state. So then comes to the next column U. There is an option whether that mobile number belongs to self or a family or others. So based on the mobile number you can select this option. So right now I'll select self. Then comes postal code. So kindly note here, this postal code belongs to the resident of the healthcare worker, not the institutional postal code. So this postal code is the resident of the healthcare worker. So you have to mention the postal code of the resident of the healthcare worker. Current residing. So that will be better. Current residing of the healthcare worker. Then comes employee ID. Employee ID is where your institution has issued an employee ID to an employee. If there is no employee ID, you can mention it as NA. So if there is no employee ID, you can give it as NA. Then comes the last column X, which is very important. Can health worker be a potential vaccinator? So there is a drop down here, yes or no. So what does it mean? Can health worker be a potential vaccinator? It means whether the healthcare worker has the capacity to vaccinate others, or he or she trained in vaccination or vaccinating others. So usually these columns apply for a staff nurse, medical officers who are involved in vaccinating or who know the procedure of vaccinating. So only for those people you have to give it as yes, and the rest of all comes under no. So in this column I've mentioned it as medical officer, category of health worker as a medical officer, hence. So here I will show it as yes. So again I'm repeating, the meaning of this potential vaccinator is nothing but where a healthcare worker has the capacity to vaccinate others, or he or she is trained to vaccinate others. So that is the meaning of potential vaccinator. So this is the way of typing each individual healthcare worker details. if your institution has more than 1,000 healthcare workers, so kindly note, if your institution has more than 1,000 healthcare workers, you have to make two Excel sheet. One Excel sheet can be filled for 1,000 health workers, and if you have more than 1,000 health workers, you have to make another Excel sheet. So I'm just going to explain how to do that. So before that, so each health workers data need to be filled. No cells should be left blank. Any cells which is not applicable can be mentioned as NA, and any cells which has a drop down should be selected from the drop down column. Now we will go to the next part, how to save the Excel file. So when you click on file name, so here you have to go to save as. You can see here the Excel file is named as COVID space vac underscore import space beneficiary underscore state underscore UT underscore Bangalore. Till here is a fixed file name. So kindly note, till here it is a fixed file name. From here you have to give your facility name as the Excel file name. I repeat, from here you have to give your facility name as the file name. For example, I have entered this Excel sheet of KIMS Medical Institute. So now I am giving the name of the Kempegowda Institute of Medical Science. So till Bangalore Urban is the fixed file name. From here you have to type your facility name. So the facility name goes like this. After district name underscore Kempegowda underscore institute underscore of underscore medical underscore science. So this is the way of mentioning the file Excel file name of your facility. So Kempegowda underscore institute underscore of underscore medical science. So this is the way you have to mention your facility name. So kindly don't use space. Kindly don't use space or a dash. It has to be underscore in the place of using space. So after entering your file name, you have to save it in a right format. So kindly click the type of the Excel formats you have. In the first format, there is a Excel workbook dot XLSX. Excel workbook dot XLSX. The file has to be saved in this format only. Kindly note, the Excel file should be saved in the .xlsx format only. .xlsx format only. Then you can select where you want to save the file. Then save the file. Now the file is been saved. So after saving the file, kindly mail it to Bengaluru Urban COVID-19 private at gmail.com, pvt at gmail.com. So the saved Excel file to be mailed to this mail ID only. I hope this video will help you in filling the healthcare worker details. For any clarification, you can email to this mail ID. So we'll clarify your doubts. So thank you all.